Hello and welcome to Java with Jim. I'm Jim Reese, Director of Business Development at Offit Kurman, joined here today with Jacquie Cohen Roth, Founder and CEO at Cannabis MD and TPAD. Jacquie, how are you today?
I'm excellent. Thank you so much, Jim, and kudos on the hat.
Thank you. Thank you. It's part of me now. It doesn't
Yes.
go outside. I just want you to know. And also people have asked me, yes, it does get washed.
Okay.
So Jacquie, thanks for asking. Jacquie, tell us about Cannabis MD and TPAD and what do you do and how are you different from other entities in the industry that you serve?
Okay, great. Well, thank you so much for this opportunity and to be able to share what Cannabis MD is all about, as well as TPAD. So Cannabis MD is a is the multimedia platform with the mission to educate, build, and engage an ecosystem of stakeholders to deliver optimal patient and product outcomes specifically in the medical cannabis industry. Our content and our programs are focused on the integration of cannabis science, policy, and business. Its philanthropic arm is TPAD, which has the mission to break down barriers to entry and advancement in the cannabis industry, no matter gender or race, via education. So very simply, is that Cannabis MD is the organization that is focused on delivering the education, whereas TPAD, the philanthropic arm, is focused on providing opportunities for that education, and TPAD is particularly focused on advancing women and people of color in cannabis STEM, that's science, technology, engineering, and medicine. What differentiates, I'm sorry.
Go ahead.
Yeah, what differentiates a couple of things, but actually both organizations are founded on the Hebrew principle of tikkun olam, which literally means repair of the world. And how I aim to accomplish that is via education and education focused on plant-based medicine. And then another differentiator of both organizations, but Cannabis MD being at this point, the bigger of the two, is the team of folks that I work with, where the majority of us have this unique graduate degree, the first one actually in the world, from the University of Maryland School of Pharmacy, the Master of Science in Medical Cannabis Science and Therapeutics. And I'm now an adjunct in that program. So very excited to be part of that program.
Congrats. What a great segue to my next question when you talk about your team. So when it comes to Cannabis MD and TPAD, what are you most proud of?
Lots of things, actually. It's certainly been a journey, and folks that work with me understand the energy level by which I work, and it's matched up well with this cannabis industry, which is crazy. It is a rocket ship. And so Cannabis MD was actually born out of a successful pivot of mine in 2017, where prior to that, I was in the conventional healthcare industry, where the company I had was an MBE, Maryland certified minority business enterprise named Mojo Media. The first thing that I did with Mojo was publish a magazine, Chesapeake Physician, Your Practice, Your Life, where our content focused on innovation in clinical diagnostics, clinical treatments, healthcare information technology, which was relatively new at that time when I launched, policy, law, compliance, and best practices, no matter the size of practice. That led to working with some really significant players in the healthcare industry, certainly within our region, that being DC, Maryland, Virginia, and then nationally. So I partnered with Johns Hopkins Medicine, University of Maryland, a medical system, Nova Healthcare, MedStar on physician engagement strategies. And so that was all well and good from 2004 to about 2017, when I recognized the need to pivot with the impact of the Affordable Care Act, that is most folks know as Obamacare. And what happened with healthcare is that it became siloed. So, the bigger systems were eating up the hospitals, just that gobble, gobble, gobble down the food chain. And that certainly impacted my bottom line, where, essentially we were focused on driving referrals and impacting referral patterns. So at the same time, as a cannabis geek, I would call myself policy geek, economics, and healthcare, is that I was following or have been following the cannabis industry, particularly medical cannabis, for decades. And with the legalization of medical cannabis, the first state was California in 1994. I recognized that there was, we were going to the industry was going to be making its way east. We started to incorporate content focused on medical cannabis in Chesapeake Physician, recognizing that I'm talking to, or our audience is a very conservative audience of physicians and healthcare stakeholders, but introducing adjunctive therapies, whether it be medical cannabis, acupuncture, and raising this awareness. The lens at which I see things through, my sister is a very conservative orthopedic surgeon. And so, all right, how's she going to take a look at this? And that's been some interesting stories along the way. In any event, I recognize the need to pivot, but I wasn't quite sure, what I wanted to do with that. That led to working for actually my best client, which is a very large national imaging group, where I was a sales manager for a team of multiple practices. I pretty much had to learn a fellowship in radiology in a very short period of time, which I had to know the inside and out of every piece of imaging equipment, but recognized it wasn't the best fit for me. We parted company. It was a great end to our partnership within 6 months, where, I'm an entrepreneur at heart and soul. To the aforementioned big sister, I hustled her when I was 10 to fund a white mice enterprise that I had, which ended up with a lot of white mice in our house. And then I went to work for Nordstrom for 90 days, or I thought, all right, I just need something that's not a really big focus on brain power, but figure out what I wanted to do, and started to conceptualize Cannabis MD. I spent 4 times what I earned at Nordstrom's, but out of those both experiences that I learned that, again, heart and soul an entrepreneur, heart and soul healthcare, the clinical space, education, patient care is at the core of what I'm passionate about. And I didn't see anything at that time for Cannabis MD, what it became to be. And Maryland's medical cannabis program went live for patients in 2017. TPAD went live December 17, 2017 with a tweet. So that was it, off to the races. October 2nd, I think it is, 2018, our website went live, and shortly thereafter, we had a global audience.
Amazing. That's quite a journey. And I must say, as you know, being a true entrepreneur, you are definitely where you should be right now.
Yeah.
It took you a nice journey to get there, but you made it.
Yeah.
So Jackie, July 1st, 2023 is one of those red letter dates for the cannabis industry in Maryland. What do the next 6 months look like for you and Cannabis MD and TPAD?
Yeah, well, certainly dynamic. Nothing slows down here. So one of the things, actually, the hearing for this the implementation bill, it's titled Cannabis Reform, and this is what stands up the adult use industry. So with that, there's some misses in that bill that certainly we're going to be going through this process of amendments. But with that are a couple of funds that are part of that that are going to enable me, and that are also necessary for the communities and individuals most harmed by the war on drugs. So part of that will be working with the state on a couple of unique grant opportunities focused on education. I think it's extremely necessary that we have both patient and consumer education. At the MMCC, Maryland's regulatory body, has done a lot of great things, but there are misses that cannabis needs to be part of the public health conversation. And So that's an area of focus for me, Cannabis MD, as well as I've started a $500,000 seed round. So just in the beginning of that, we have my first investor, very excited. And so that's going to enable me to build out Cannabis MD to the vision that I've had for the last 5 years. There's also some unique grants. I'm in conversation with the Department of Labor, Maryland Department of Transportation, again, focused on, and this is the opportunities are both engaging with Cannabis MD and TPAD. So things like workforce development, the adult use industry is going to provide thousands of jobs, and folks need education.
Yeah, plenty of opportunities for education, that's for sure. All right, so Jackie, what do most people watching this not know about you?
Lots. So,
One or two tidbits.
Yeah, I will share. Well, I am going to write a book someday. And a lot of people have said, you have to write a book. So I intend to do that at some point. I'm going to slow down and get that done. But there's one story that actually it's two, and they intersect that I think are symbolic and representative of my grit and resilience. And I think this is the time of how we met, where I was hit by an SUV riding my bike. That was, I'm here to tell the story. The same spot 3 weeks prior to that spot on the highway in Annapolis, somebody was killed. And with that impacted a shoulder injury that I had, which ultimately led to the need, or I had a torn rotator cuff. But with that, I hit a hole-in-one at Pinehurst, the legendary golf course. And I think it was about a month and a half later, I had that necessary shoulder repair. And so again, I think of that, and I've got the bag tag, June 3rd, 2018, when I hit that hole-in-one. And again, I consider that as symbolic to me for so many reasons of my grit and resilience. And you were so kind. I remember being in your office that it was either after the bike accident or it was after the surgery, but I was a one-armed bandit, and you helped me out managing my iPad.
Okay, good. That is quite the story. I mean, there are people that go through their lifetime without getting a hole-in-one, never mind the shoulder injury. So kudos to you. Jackie, it's been great chatting with you. Thanks so much for sharing all this information. I know you're going to be so busy in the next year or year plus with the changes in the laws related to the cannabis industry in Maryland. So they need the education. Keep pushing.
Thanks so much, Jim. Really appreciate the opportunity.
All right.
Great to see
Bye.
you. Bye.